Today on Monkey Life. Problems for the team when Chimp Cathy goes under the knife.
She's carrying a bit of extra fat, shall we say. So if I put her on a level, the weight of the excess fat in the abdomen presses on the diaphragm, stops her breathing efficiently.
Woolly monkey Lena is pregnant, but who's the daddy?
The father could be Oscar, who she's living with at the moment. However, there's also a possibility that it could be Bueno.
And as the team prepare for a new arrival, hopes that Oshine will act as a surrogate mum.
Hopefully Oshine has got maternal instincts, and the only way to find out is to wave a baby under her nose.
Monkey World in Dorset is the largest sanctuary of its kind on the planet. For 25 years, the team have been rescuing and rehabilitating primates from all over the world. The centre was the mastermind of animal campaigner Jim Cronin, who undertook numerous high-profile rescues along with his wife, Alison.
And how much does she want for him?
10,000 US.
One of the most memorable was of Chimp Charlie, who was rescued from Turkey, where he'd been trained to do tricks for his own TV programme. Jim persuaded his owners to let him take Charlie back to the park.
I can do this. Yo, bravo. I know this one myself. Bravo. Yeah.
After Jim's death in 2007, Alison took over the reins and continues to save maltreated primates.
They're all going to have a chance to live proper lives again. Perfect.
The park is home to more than 240 monkeys and apes from 15 different species. One of the first groups to be established at the park was Paddy's chimpanzees. 6 members of the group have been here from the very beginning. Paddy himself, along with Beth, Cindy, Mickey, Zoe, and Buster. They were all rescued from Spain, where they were being used as photographers' props. But today, all eyes are on another member of the group who's been having dental problems.
Cathy! Oh, good girl.
Cathy has been at the park since 1990, after being rescued from a French biomedical laboratory.
Hello, Cathy. Good girl. Here we go. Cathy's got an overgrowth of her gums, both on the top and the bottom. And the gums, in some cases, are completely covering her teeth. Were you doing open? Open. We're not quite sure what causes it. It's a little bit of a mystery. There's no evidence that she's in pain. I think it's definitely getting to the point where it's uncomfortable for her, because at the bottom, maybe she'll do an open for us, you can see that it's really growing over her teeth. So when Cathy's eating, it only gives her a really small groove for her tongue to go through. So it has got to the point where we're going to have to do something about it.
The team have decided to operate, and they've called in wildlife dentist Peter Cortez.
We're going to have a look, and we're going to reduce the size of the gum because it's interfering with the eating now. The cause, well, we don't know what the cause is. Usually, in humans, it's medication. A medication for epilepsy or contraceptives or pregnancy can cause these isolated areas of very swollen gums. But we'll have to cut them back because she's having difficulty in chewing now.
But before Peter can get down to business, Cathy needs to be anaesthetised. So wildlife vet John Lewis, animal director Jeremy Keeling, and the park's vet Mike Nathan head down to her enclosure. She's been kept inside, away from the other chimps in her group, who can sense something is wrong.
Well, they probably do know something's going on. I mean, one is being locked away on her own. I turn up. You can add 2 and 2 together and come up with something unpleasant, yes.
It's down to the primate care staff to give Cathy the anaesthetic.
They're the ones that are trained her to accept hand injection. And the last thing in the world she wants to see is me, because I've darted her in the past and she'll smell a rat. So I'm just keeping out of the way. If they can't hand inject her, then okay, I'll use a blowpipe. But I'm just, keeping out of the way.
Putting any animal under anaesthetic is risky, not least a 30-year-old chimp.
There's no anaesthetic, be it for chimps or giraffes or yourself. None of them are 100% safe. So if you can avoid anaesthesia, you do. Or conversely, you need a good reason to anaesthetise an animal, because, you know, things happen, and occasionally you have a problem.
Once Cathy is safely asleep, the team need to get her to hospital as quickly as possible. The rest of the group are still agitated. They're a close-knit bunch and very protective of each other. At 77 kilos, Cathy is a heavy chimp, so she's not easy to manoeuvre.
You happy with that?
No, that needs correcting, Jeremy. Push her further in. Right, then we can straighten her head up.
You better with that?
I'd like something there, actually. Just a roll. That's good. That's good. Yeah.
Peter wants Cathy to lie on her back for the operation, but John is wary because of her size.
Peter, we'll try her on the back. That may not work for us. We're going to have the table sloping down, so this end is up a bit and that end is down a bit.
Sloping the table.
Either way, we want that end down. All right. Whoa, whoa, whoa. You guys are going off on the side. Hey, that's it. That's good. She's carrying a bit of extra fat, shall we say. So if I put her on a level, or even head down, the weight of the excess fat in the abdomen presses on the diaphragm and stops her breathing efficiently. But also it presses down on the main vein returning blood to the heart. So you end up with lungs that are incompletely filled with air and incompletely supplied with blood. That's why we're sort of aiming her down, so the weight of her guts are not pressing on the bottom of her lung or the vein that returns blood to the heart. If I take the head, other people can take other bits, please. Over on her back. That's right. Can we centre her? Yeah. OK.
Once Cathy is in position, Peter can examine her gums.
Just have a look, can I, please?
Yeah. So she's pink.
But it's not good news.
This is not swollen gums. This is ossified fibroma.
What looks like overgrown gum certainly is gum, but underneath that overgrown gum, there's bone, you know, abnormal bone. So it will take a lot longer to get the excess tissue away.
Scalpel, please. We are going to take away the bony growth and have to try and reconstruct the gum afterwards.
Cathy's gum problems are more serious than first thought. The operation isn't going to be straightforward. Over at Oscar's woolly monkey enclosure, Lena is causing a bit of a stir.
Lena!
Staff are pretty sure she's pregnant, which is great news as woolly monkeys are seriously endangered, both in the wild and captivity. Pregnancy tests are notoriously unreliable for woolly monkeys, so the only way to really tell if Lena is pregnant is to feel her stomach.
She doesn't mind it whatsoever. We have been working on her quite a lot recently, trying to get her used to the sensation of us prodding around in there. So yeah, she doesn't mind it. As long as she gets lots of treats in return for it, she really doesn't care. We're feeling for anything that may indicate a baby, so what we tend to find with the woolly monkeys is that very early on in the pregnancies, the stomachs become very, very tight and enormous, and then we tend to think that they're much later on in the pregnancy than they actually are. They keep us hanging on for months, and we're saying any day now, and it never usually happens when we think it's going to.
Woolly monkeys are extremely difficult to breed in captivity, but Monkey World has been very successful. It's the only place in the world at the moment where numbers have been increasing. However, staff aren't sure who the father of Lena's baby is.
The father could be one of two different males. First of all, it could be Oscar, who she's living with at the moment. However, there's also a possibility that it could be Bueno, who's the male that she was living with previously. So obviously we're not going to be able to tell that until she gives birth, and then we can work back on the dates and see who the dad is.
Bueno arrived at the park in 2005 and has already fathered 3 children: Julio, Inca And latest addition, 3.5-month-old Enzo. Bueno is well respected in his group and seems to be popular with the females. Oscar, on the other hand, arrived just a few months ago from Basel Zoo in Switzerland. He's important to the woolly monkey breeding programme at the park because he's unrelated to anyone else here and until now hasn't been a dad.
Oscar is wild caught. He was born in the wild in South America. And like the story with him is that his parents and family were killed for bushmeat, which is quite often the case with woolly monkeys. The babies are too small to be used for bushmeat, so instead, once they've killed the mums, they take the babies away and the babies are sold into the pet trade. If Lena is pregnant and it does turn out that Oscar is the dad, it's probably the best news that we could have hoped for. They are so rare and so endangered that every individual is very, very valuable.
At the park's hospital, Chimp Cathy's overgrown gums are proving to be a challenge for wildlife dentist Peter Cortez.
This is not simple. What we have to do is expose as much of it as we can. And then we're going to have to take away as much of the bone as practical. That's the gum, but when you look underneath it, you can actually see a considerable amount of bone.
Peter has discovered that the bone which has grown up around Cathy's gums has actually fused with her canines. This is serious. Peter thinks he might have to remove all 4 of them.
All of the canines?
All of the canines.
You think it's canine?
Well, it seems to be associated just around the canine teeth. There's a little bit around there, but it just seems to be that area. And I've seen this before, and it was just the canine area.
The canines?
We removed the canine, and the condition hadn't come back now but I can't guarantee it won't come back.
Jeremy is concerned this would be a big operation and too much for Cathy, so he calls Alison for her opinion.
But we may not do all the canines today. It might be just 2 canines. No point killing her for 4 canines.
In the wild, chimps use their large canine teeth to defend themselves as well as for eating. Alison has come straight over to the hospital. She's not happy about Peter's plans to remove all 4 teeth. She thinks it'll be too much for Cathy to cope with.
We've done this once before.
All 4 canines. I have a problem. She's 30 years old.
Is she?
Yeah.
I'm going to take this one out because it has to go because it's broken. It would fuse to the bone.
Okay, so one's gone
That's
anyway.
got to go.
No,
it's going to go.
Is there any guarantee if you
No
remove
guarantee.
them
So
that
it's
it's
a
not
greater-
going to come back?
There's a greater chance of it not coming back if the canines are gone. A greater chance, but there's no guarantee.
John Lewis, what's your vote?
My vote is for closing that without removing the upper canine. And once this side is healed up, then do the other.
Okay, and then
All right.
we might get an idea if the condition comes back around that top one.
It's pretty bad on the other side as well.
Okay, we're not going to be able to address that all on this go.
I don't think you should extend it to 4 hours. No,
Okay.
not push it.
Okay.
It's dangerous for any animal to be under anaesthetic for too long, and Cathy has already been under for more than 2 hours.
The lower one for you.
So, with 1 canine removed, Peter winds things up.
Just check the throat, John, because there are lots of bits of teeth around.
The team want to get Cathy back to her group and bring her round as soon as possible.
Look, I'll go backwards this time.
I don't mind going backwards.
Paddy and the others are excited to see her back.
Mind the step.
She's put in her bedroom so she'll be more comfortable when she wakes. John continues to monitor her. This is a dangerous time for Cathy. As the anaesthetic wears off, her blood pressure readjusts.
We just close the door, don't bite it.
Generally speaking, they wake up quite quickly. But in her, she's had a fairly heavyweight painkiller, and that slows her recovery down, but gives her far greater pain relief. She's just kind of taking her time, which is fine. That's fine.
Cathy coughs as she wakes because her throat's dry. This is normal when coming round from an anaesthetic. John is optimistic.
She gets a course of antibiotics because there's a risk of infection there. So if it's all settled down in 6 months, we'll then talk about doing the other side.
So Cathy may have to have another operation, but for now, she's just going to feel groggy and sore for a while. Gordon's orangutans are having a barrel of laughs. They've been given a variety of coloured tubs to keep them busy, and they're making the most of it. Young Kai wants a drum of his own, but stepdad Gordon has other ideas. Both Gordon and Tuan's groups are being kept indoors because their outside enclosure is being split in two and having a major overhaul. Until now, the orangs have had to take it in turns to use the outdoor space, but this revamp will mean they'll all have permanent access outside. The work's going to take at least a month, which is a long time for the orangs to be cooped up.
Our primate care staff, they've done an absolutely fabulous job keeping them really occupied, coming up with new ideas to keep them entertained, new ways of feeding them, fun activities. The orangs are so intelligent, so incredibly intelligent, and so critically endangered that I'd really like to be able to build them an environment that might not be the wild, but that at least provides them with comfort, security, and a place that actually feels like home to them. We've sort of added in, I don't know how many more hundreds of telephone poles to create more connecting walkways, lots more platforms at different levels, shelters of all different descriptions and so on. It's going to look very different. It's going to feel very different. Most importantly, I hope that the orangutans are going to love it.
Unlike Gordon and Tuan's groups, the nursery orangs are choosing to stay inside. And newest recruit Oshine is finally beginning to make friends. Albeit slowly. She was brought up as a pet in South Africa and had never come across other orangs until she arrived at the park. At first, she struggled to adapt to life alongside others of her own species, preferring Jeremy's company. Her first meeting with head honcho Arme and her sidekick Jolie didn't go well.
Arme?
Arme, no.
Arme. No, that's not such a good plan. She's bigger than you. There you go. That's good. Control. There we go.
So they had to be separated. Arme is still being kept apart, but Jolie has been reintroduced to Oshine, and the signs are good.
Oshine has made so much progress, it's unbelievable. When she first arrived here, she'd hardly move unless you went to her. You've got to remember, she spent pretty much 13 years on her own. She doesn't know she's an orangutan, although she's learning to be one. So she needs to learn how to play. She's never done it before. So bringing Jolie in, she's wary of her, but not as wary as she was when she first met Dinder and Linga. So I think she's slowly starting to learn now that she is an orangutan. They're not that evil. And yeah, give her time and hopefully she'll settle in and hopefully start playing with them. Before, she wouldn't come over to the door here to have anything to drink or eat if the others were around her. So the fact that she's tolerating, albeit it's Dinder at the moment, tolerating Dinder being quite close by is progress.
Life is about to change yet again for Oshine. There's going to be a new baby in the nursery, and it's hoped she might act as a surrogate mother. Sylvester is an 11-month-old orangutan currently living at Santillana Zoo in northern Spain. His mum refused to feed him, so Monkey World has been asked to step in. Jeremy is about to board a ferry to Santander to pick him up.
He's coming to Monkey World because we are the official creche for young orangs that are being hand-reared. So he'll be reared actually with our young people. Then he'll think like an orang rather than a human.
Jeremy will have to hand-rear Sylvester at first, but he's hoping his services won't be needed for very long.
So that's where, hopefully, Oshine steps in And we don't know yet because we don't have any experience of Oshine with babies, but hopefully Oshine has got maternal instincts, and the only way to find out is to wave a baby under her nose.
The nursery will be perfect for Sylvester, as Jeremy is keen for him to have contact with lots of orangs as soon as possible.
But at the moment, it's just important that Sylvester realises that he is actually an orangutan and not some peculiar-looking human.
It's important for Sylvester to get to know Jeremy before he's transported back to the park.
So if Sylvester knows me in his comfort zone, then hopefully that will make him happier when he's out of his comfort zone. His routine might not suit our routine, and that doesn't make it bad or good, but he'll want to maintain his routine to keep him comfortable, at least for a while, and then we'll slowly introduce our routine, and then he won't be missing anything.